be very, very low. All right, so you may be curious or not, why does ApoE4 increase the risk for Alzheimer's? And we don't know. We have colleagues that are studying this, but here's a possibility, here's a hypothesis. First of all, we don't know what causes Alzheimer's disease. We don't. So some people think it's amyloid, beta amyloid. And that's the most common theory for Alzheimer's, that it's an amyloid, it's called the amyloid hypothesis. So these little gold dots here are standing for beta amyloid. They can aggregate into a plaque, like those little smudge balls that Dr. Alzheimer saw under the microscope and formed the basis for our diagnosis. And these little gold things here are toxic to the nerve cell. Do they cause the tangle? Maybe, we're not sure. We haven't proven it yet, because the Alzheimer's is both plaques and tangles. How do we clear? Well, first of all, we're all making amyloid. It's part of our normal metabolism. As we sit here every hour, we're making millions of molecules of beta amyloid. And if they're toxic, well, how do we clear them? So there's several different pathways to clear them. One of them is that it's eaten up by the microglial cell, which is a garbage cell that comes around, a scavenger cell that cleans things up. Okay. Now, the ApoE carries, it's this little red or pink curved thing here. It usually binds cholesterol and lipids. That's the blue here, lipids, fatty acids. And the brain needs a lot of healthy fatty acids for the membranes. And Dr. Harrington talked about another hypothesis, and he's the leader on this, that Alzheimer's may be related to unhealthy membranes, which are made up of lipids. And he's a real expert on lipids. He's a wonderful chemist. ApoE is a carrier for these fatty acids or lipids, and it also carries this soluble beta amyloid. So it helps take the amyloid to the scavenger, which disposes of it. Another pathway is that the amyloid goes out into the blood vessel and then is excreted from the body. Maybe whizzed out, and maybe there's, besides amyloid in our urine, there's probably also lipid products. Yeah, so a lot of things are coming out, and either from the other end. I got it. So here comes the part where it's important to have healthy blood vessels, because that is one way that we're clearing the amyloid that we're making out of the